Hi, it's Shannon here from the Anxiety and OCD Treatment Center of Central Pennsylvania. And today I'm going to talk about your top 10 questions about exposure and response prevention. So if you're someone who's been like thinking about treatment, but kind of hesitating because you don't know all of the information, hopefully in this video, I'm going to answer those questions for you. So I am a therapist in Central Pennsylvania in a private practice with two other clinicians, and we almost exclusively treat OCD and anxiety disorders. And I've been doing this work for over 12 years. And I truly, truly love it because I am able to see people get better using exposure and response prevention. So today I just want to shed some light on this treatment option, and it is certainly not the only treatment option out there, but it is the most evidence-based currently. And I know for myself, it was really helpful in my recovery, and it is really helpful to a lot of my clients. So I just want to kind of clear the fog for you and give you some practical insight, and hopefully this will help alleviate some of your fears about the unknowns with this treatment. So question number one, what is ERP? So you often hear ERP referred to as CBT. And CBT is the cognitive behavioral therapy umbrella under which a lot of treatment modalities fall. So acceptance and commitment therapy, dialectical behavior therapy. So these are all types of CBT. And so what this really means is that we look at thoughts and we look at behavior. And so exposure and response prevention, or ERP, or you might hear it referred to as EXRP, and is a type of therapy that really involves exposing individuals to a situation that triggers their obsession or fear, while simultaneously preventing a corresponding compulsion or ritual. So it is a bit like facing your fears, because I know I've had people say, isn't this just like facing your fears? Well, it is, but there is a systematic way in which we do that. And there's tons of research supporting this. So many people want to know why they should use ERP to treat their OCD. And just again, I just want to say currently ERP is really the most evidence-based practice for treating OCD. And what we're doing is we're really trying to break that loop or that cycle that you're stuck in with the disorder. So the person who is doing ERP learns to tolerate the discomfort and uncertainty, which eventually leads to a reduction or an elimination of symptoms. So number two, why is ERP effective? So, I mean, I get it. Facing your fears head on seems really counterintuitive. And so when I tell people about the treatment, they're kind of like, you want me to do what? But think about it this way, that like avoidance of these things that you're fearful of keeps the cycle going. And ERP challenges you to confront these fears and break that loop or that cycle that I was just mentioning. So it's really tough. It's hard work, but it's really transformative, I promise. Number three, how long does ERP take? Or will I have to do this forever? So this one's a really common question. Some of the time this question is about finances and that the cost of specialized treatment is expensive, but it really is a worthwhile investment. And so the truth is, for most people, it really varies. And so even though I think when exposure and response prevention was developed, I think it looks at like a 20-week or 24-week treatment protocol. If I can remember correctly, it's been a long time. But in reality, some people see progress in weeks, and while others, it may take months or sometimes even years. And some of that is really about like the buy-in or the motivation, the support that people have. There's so many factors. And so I just say like the key is really stick with it and not lose hope. And so also remember, it's not a marathon, it's a marathon, it's not a sprint. So we're not like trying to get better so fast. We're on a journey with this. And so um the other question of like, is this something I'll always have to do? I think a good way to explain it is that, like, if you have a garden and you really love having a garden, you have to weed the garden every so often. So that's kind of what living an exposure lifestyle is like with OCD. We want to make sure that we're not avoiding anything and that we really are like tending to the things that pop up instead of letting them grow and get out of control. And so although we don't have to do daily exposure anymore after we reach what is called recovery, we still want to kind of pepper in some exposures here and there, or weed the garden. So will an ERP make my anxiety worse? And I would say yeah, right? Like it's not a walk in the park. It is something that is going to, I always tell people like, hey, are you willing to suffer? Like you're already suffering. This is just going to look a little different. And this is going to give you long-term results, not short-term fixes like you're getting by doing compulsions. And so if if it involves gradual and consistent exposure, it really breaks that need for the short-term fix and gives you long-term results. And that's what's really important to remember throughout the course of treatment. So when you're kind of like, why am I putting myself in this situation and making myself feel worse? So what does an ERP session look like? Okay, so this is something people want to know, or like, well, what kind of stuff are you going to make me do? And I see this especially with folks who have particular, what we would consider taboo obsessions, things of a sexual nature or harm related. Folks are really curious about what exposure is going to look like for that. So, so whether you're going into doing exposure and response prevention on your own using a workbook or a course, or with a therapist, expect yourself to be uncomfortable, okay? And that you're going to be intentionally exposing yourself to thoughts, situations, or images that trigger your anxiety. And you're going to be practicing resisting doing anything to relieve that distress that shows up. So, some examples of exposures are like going to a place that you might avoid on purpose, or it might mean that you're going to use some knives and chop vegetables with your child in the kitchen if you have fear of harming them, or if you have pedophile OCD thoughts, it might mean that we're going to be around kids, right? So those are some examples of exposures. So is ERP safe? So, I mean, safety is important, right? And personally, I have done ERP with pregnant women, with individuals with heart problems, but we always check with the healthcare provider before starting to do something like that, just in case, because it does, like if an increase in anxiety could affect any type of medical condition, we do want to know that and take precautions. So the answer is yes, it's safe, but just always check with your doctor to be sure. Okay. And should I do ERP on my own or with a therapist? So I do think the possibility of the best outcomes would be to do it with a professional, a therapist, or someone trained in exposure and response prevention, or even a few sessions from time to time with someone. So you truly know what you're doing and that you're doing it right. And so there's also courses available. There's a lot of individuals that treat OCD and anxiety that have courses that you can take. So I do think those are a good option. And like I said, there's workbooks and things like that. But definitely having some sense of guidance or accountability can really be helpful. Number 8. So what if I can't handle it? So what if my anxiety gets too high and I just can't tolerate it? So what I would say is, I mean, if we were in treatment together, I would say, okay, we're just going to dial it back and we're going to pick something just a slightly bit easier, or we're going to really try to encourage and push through so that you can see the long-term results. So, and I think most people, I've never had anyone really who was like, I can't handle this. But I do think for some people it does take a lot of practice of being okay with discomfort, because some people do everything to avoid any type of discomfort at all costs. So like boredom even. And so we do practice like sitting with some of that stuff. All right, number 9 is, can I take medication and do exposure and response prevention? So there are certain rules about medications while doing ERP. There are a class of drugs that are called benzodiazepines, and it is not recommended that you take that while doing ERP. So usually the recommendation that I give clients, if you are on a medication like that, obviously you want to talk to your medical provider, because I'm not a medical doctor. But what I would recommend would be that you could do exposure 3 hours after taking that type of medication, or even if it were drinking alcohol, using marijuana, any of those types of things. You know, we always recommend that there's a significant time period after taking something and before taking something. So we were looking at like that 3 hour mark. Otherwise, it's very common for people to be prescribed SSRIs, which are serotonin reuptake inhibitors, and those are used to treat anxiety, OCD, depression, not all of them, but just to give you a general idea. And those are perfectly fine to be taking while you're doing exposure and response prevention. So my recommendation though on the medication question is to always talk to your doctor or your psychiatrist. And if you can, find somebody who really knows and understands OCD. The International OCD Foundation does have a list of commonly used medications and their dosages on their website. So the last question here that I'm going to go over for this video is, how do I find a qualified therapist? So I always tell people, check out the IOCDF, which is the International OCD Foundation. Check out their resources page. They list individuals who usually have had training with them or folks that are very interested in treating OCD. There's also on their site, there's a list of questions to ask a therapist before getting started with them, because there are lots of folks out there that say that they treat OCD and really they don't use evidence-based treatment for that. So I recommend at least looking at those questions. Maybe you throw them out there to somebody when you are kind of interviewing them for treatment. I also might do another video later on this particular subject of finding the right treatment, like moving on if it's not the right treatment. So these are my final thoughts, right? So whether you're just starting to understand what exposure and response prevention is, or you're kind of deep in the trenches of doing it, know that support and resources are out there. We have a lot of great resources with my practice. Our website is isthisocd.com. So you can always check out what we have on there. We have a list of books. We have a list of more intensive or residential treatment providers. There's usually some blog posts, links to YouTube videos, stuff like that. So those are some good resources for you. And then if you're ready to take the next step and get involved in something, like I said, seek out a licensed, therapist who's trained in ERP. Certainly I have a course coming up. It's going to be called Finding Freedom, the Anxiety and OCD Recovery Roadmap. And so what that's going to consist of is about 8 to 10 weeks of modules that will offer basically all the treatment that I give to clients. And it's also going to offer live sessions with me once a week on Thursdays. And there are some other options with it. So that will be coming out soon. And certainly it might be a really valuable option and a way to get treatment. So I guess there you have it. I answered as many questions as I could about exposure and response prevention. And if you found this helpful, please don't hesitate to share it with others that might be in the same boat. And together we can ride the wave in navigating this disorder. So thanks for checking this video out.